Hi, and welcome to this edition of the Insurance Experts. It's my pleasure to have on the line Joanne Giardini-Russell, who I met on LinkedIn, actually. She's here to share her Medicare expertise as a specialist. Joanne, thanks for joining us today.
Absolutely. Thanks for being here.
So how did you get into the wild world of Medicare planning?
Oh, it's a long story, and I won't bore you with all the details, but essentially I was in a financial planning office, kind of partaking in cases with 25 advisors. And long story short, I learned that I didn't know anything about Medicare. And worse than that, because I had two healthy parents, everyone in the office didn't know anything about Medicare. So it kind of blew me away. And it really became just a niche of like, holy smokes, nobody's doing this, in my opinion, doing it very well. And learning, et cetera. But there's financial offices across the country that just aren't discussing Medicare. And it was just eye-opening to me. So fast forward, here we are.
Do you work mostly with financial professionals, or do you work with clients directly? How do most of your clients come to you?
We do both. We look at our financial advisors sort of as our one subgroup of clients, truly. They're clientele to us. Because we're a value add to them. The ones that are really looking and taking care of their client have no problem just referring them to us. We do nothing but Medicare too. So we're not doing any other product, no annuity, no life insurance, no short-term care, not long-term care, nothing. So we're really there just to be an ancillary arm to them of service. And then we get the clientele from them, which is great for us because we get really, really good clients. It's like, hey, John said to call you. Really, really nice. So we do CPAs, financial planners, HR, and then group benefit people are probably our four biggest referral sources, and it works out pretty well. So we do that across the country with all of these people.
Very cool. Well, I know we have a lot to talk about in the Medicare world, but specifically, I know you had a case recently with a guy who was continuing to work past the age of 65. So tell us a little bit about this scenario and how it came about your desk.
Yeah, it was pretty neat. It was a referral from somebody else, and the wife had phoned me, and she's 76. And she said, we heard about you from a couple people, and we'd like to talk. My husband's 86, and he's just retiring. And it was really cute because we are virtual, so we try very hard to say, no, we will not meet live. This is our version of an appointment. So it works really well. But I said, I live about 20 miles from me, and I said, all right, on a Sunday, if you're open for a Sunday, I'll come out and see, because it's not many people retire at 86 years old. So it was really cute. So I'm in their kitchen and we're talking, and over the phone, I had gathered that they were not on Medicare. I know he was working. It's a large employer, so it really wasn't a concern. So when I got there, we're chatting, and somehow I just said, well, wait a second, you're on Medicare. And he goes, yeah. And I'm like, why? Because he didn't need to be. That was the biggest thing. He was on group insurance for 21 years, he and his wife. Spending a large amount of money on the group insurance. So the employer was not paying 100% of this, 80%, nothing. Not that he was doing the full freight, but he was paying a lot of money. And I said, well, why did you do Medicare back when you were 65? And he said, because I thought I had to. No one ever told me I didn't have to. So it struck me that day as a lot of people go through this, but he's 86 for 21 years. Somehow this happened where nobody caught this. The group people didn't catch it, the CPA, the financial people. I was blown away. So he's been paying all of that for all those years. He didn't need to. In the beginning, we could have maybe, when he turned 65, we would have assessed, well, okay, your wife's now 55. So maybe that wasn't the time to go completely to Medicare, but he still added his Part B premium, which is premium based on income. So a lot of people don't understand that Medicare is income based. So his financial person, you hope, would have asked the question. Apparently not. I don't know the person, but he spent a lot of money on Part B premiums. Yeah. In fact, we guesstimated towards the end $100,000. Truly 80 to 100 grand is blown premium over those 21 years.
Wow.
And he probably would have retired at 82 instead.
Well, let me take one step back. So what I'm gathering is he literally paid for two health insurance plans for 21 years that he didn't need to pay for. He only needed one of the two. So let's say we had taken a step back and he was 65 years old and his wife now 55 years old. What would you have recommended they do at that point in time?
At the point when somebody is 65, it's really critical that these people talk to somebody at 64 and a half. And a lot of that is just it's a 15-minute phone call, an assessment of what's going on. And it's very common to have a younger spouse, but it's also very common to be working at 68, 69 years old these days. So our questions are always, what's going on? What is your access like? What is your health like? You know, because some people do want to add Part B premium, add Medicare to their group insurance because it can provide extra coverage. That wasn't his case. So it's an assessment, you know, and you have to figure out, what is it going to cost with Medicare? What if your employer pays 100% of the premium? Then we're going to say, well, stay in the group plan, you know, stay there until your wife catches up, and then we'll reassess, things like that. So we always tell people, it's like, if your health changes, if your retirement status changes, obviously if your job changes, the benefits change drastically, the employer goes from providing 80% of the premium down to 20. That's a big trigger, things like that. So it's constantly just this juggling ball assessment, but they may not need Medicare at 65 years old, but they might want to have Medicare at 65. People don't understand. That's one of probably the biggest things we see is people don't understand that they can choose Medicare. They often think that they have to stay with group insurance, and they don't. So that's really, really misunderstood.
So let's say you did that assessment at age 65, and perhaps you waited until his wife was 65 to enroll in Medicare. That way he'd be on the group plan for 10 years until he was 75, and then he'd switch over to Medicare for the next 10 years.
Right.
And I guess you said that you estimated that duplicate cost would have saved him $100,000.
Yeah, it was enormous. Again, it wasn't subsidized very well by the employer. So it's, you know, garbage insurance. He had even out-of-pocket stuff. He had Medicare. He's like, oh my gosh. And his high income status with his job, he was paying, you know, pretty high IRMA charges. And that's an income-related monthly adjustment amount, which is a whole different session. We can talk. But he was paying a lot of money. And that's times 2. So Medicare is per person, not like a family plan for group insurance. So a lot of money went out the door. So yeah, I didn't tell him. I was $80 to $100, and I didn't have the heart to break it to him.
Yeah, well, that's the key. You know, the key is to find an expert in this area. Medicare, obviously, there's a lot going on with it. So if you're an advisor out there, you definitely want to partner with a Medicare expert, just like we talk about partnering with long-term care insurance experts. So thanks for being on the show today. I'm sure we're going to have a follow-up. Maybe we'll talk about IRMA and some other topics in the future. Thanks for joining me today.
Thanks. Thank you.